Governor Roy Cooper took some time today to speak with WWAY's Jeff Rivenbark about the coronavirus and when the state may reopen. Take a listen.
Governor Roy Cooper's stay-at-home order expires later this month, and this week the governor outlined steps the state must take before movement and commerce restrictions are eased. Governor Cooper joins me now to tell us more. Governor, thank you for being with us. There have been lots of concerns about the need to ease restrictions, but you've also said we're going to enter a new normal. Can you describe what this new normal means?
Well, we know the restrictions and the cooperation of the people of North Carolina have worked to flatten the curve, and we're not overwhelming our hospitals like we've seen in other parts of the world and in other parts of our country. So that's a good thing. But we know we can't stay at home forever, and we've got to do something different. The experts tell us that if we take off all of these restrictions at once, that it would be catastrophic, that we would likely have a peak with a lot of infections. So what we plan to do is sort of like a dimmer switch in a house. Gradually ease restrictions while we're looking at data to make sure that we don't overwhelm our hospital system with people getting sick. And in this new normal, we would still be socially distancing. You may see a lot of people wearing masks in public. When you go to a restaurant, you may see it half as full as you normally would because there would be social distancing requirements in the restaurant. Those kinds of things. You may be watching a sporting contest on TV, and now most of those are gone now, but they may begin again, but you just won't have a live in-person audience. You would see it on TV instead. These are the kinds of things that I think you would see in this new normal, and it's important for us to think about this because this virus is going to be with us until we have an effective vaccine that it is administered throughout the population, and most people are talking about a year for this to happen. So if we took off these restrictions and everybody went back to normal, then I think you would see massive infections, and we don't want that to happen. But we also know that we got to get people back to work, that we got to get children back into school, and that we've got to resume our lives. It just needs to be a new normal so that we can keep people as safe as possible.
Governor, some other states are now asking residents to wear masks in public. Do we have enough supply for the 10 million plus residents in our state? And if not, where should people get them? And should people start making their own to wear?
We're in very short supply of personal protective equipment, and we want that to go to our frontline healthcare providers, our first responders, our law enforcement officers, our people who are out there on the front line, and we don't want everyday people walking around wearing personal protective equipment. There is some evidence, however, that most any kind of face covering that someone would wear could help protect other people. Not necessarily yourself, because you wouldn't have the type of approved personal protective equipment that could help prevent the virus getting to you. But a regular face covering can help reduce the amount of moisture droplets that come from your mouth and may get on another person or get on surfaces. So I think it is fine to do that. Just remember that you should have no false sense of security. Just because you're wearing a mask doesn't mean that you won't contract the virus. You still have to worry about washing your hands and putting your hands on your face and in your mouth, and those are the ways that people normally pick up this virus. You can wear a mask, however, to help other people, particularly if you're going to be in contact with other people.
And once again, Governor Roy Cooper joining us from Raleigh. Thank you, sir, for your time. We appreciate it.
Absolutely. Thanks, Jeff.